Good morning and good afternoon. Welcome to the Weekend Wellness Hour show. We are back, and today we're going to be talking about a topic related to our bodies that everyone can relate to. It's our myofascial area. We all have it, and sometimes it needs to be released. So we're going to have an expert come on. I met her through another friend of mine, Sue Ellen Strong. She's going to be joining us today to talk about her journey, how she dove into this world, what myofascial release is, and how it can help you and people around you. So thank you so much for joining us today, Sue Ellen.
Thanks, Amy. It's so great to be here. I'm very excited.
This is wonderful. And you're in, is it New Jersey, correct?
Yes.
Wonderful. Okay, so you're over on the East Coast. And can you tell us a little bit about your background, how you got into this field?
Sure. Yeah. So it's really my third career, a John Barnes myofascial release expert. And I was brought into the treatment as for my own personal journey first. About 15 years ago, I had a thyroidectomy and I had some neck pain after the surgery. And a friend had suggested that I consult this therapist who did myofascial release, which I knew a little bit about because I have a daughter with special needs and we'd done all kinds of therapies. So I came for a treatment. And at the time, I'd had a lot of stress in my life and just a lot of stress with my daughter. And basically, everything in my body hurt. Every joint hurt, every muscle, just had very low energy, was really not in a great place. And so the therapist took care of my neck pain in one session. That was easy. But then I started feeling better. Like every session, I kept coming back once a week. And it was remarkable how quickly my body started to feel better. So I was at a point in my life, I had just been doing some business development work. I have an MBA in marketing and an undergraduate degree in chemistry. And it just really wasn't very fulfilling. And I was in my early 40s and I was kind of like, what do I want to do for the rest of my life that's meaningful, that's important, that will help others? And I really felt drawn to the work, and so I went to massage therapy school. So you have to have a license to touch to do myofascial release. So you either need to be a massage therapist, a PT, an OT, a nurse, a chiropractor, a doctor. You have to have some, license to touch. So I went to massage therapy school, which you don't learn any myofascial release there, really. It's very on the surface. And then I just started taking all the John Barnes seminars. And, over each year, I chipped away at a few. There are probably about 20 of them now to complete. And over the years, I've taken every single one, some more than once. And I'm able to be classified as an expert at this point in time. So so that's really how I came to it, through my own personal needs. And then also my daughter started getting treated, and it was like a miracle for her in that she has severe cerebral palsy. And it took her very long periods of time to motor plan. So we always knew she understood what we were asking her, but it would take a very long time for her to be able to move her hand and make a choice or tell us what she wanted. She had things in front of her. And after like a couple of sessions, that response was immediate. And that was like a miracle to us, truly. And then also, people with cerebral palsy have a lot of tightness in their body, a lot of restrictions, a lot of imbalances. And the work has really been helpful to her in that she's now 24. She has never had a single surgery. So
wow.
She hasn't had to have, as a PT, she hasn't had to have any hamstring lengthening or Achilles tendon lengthening or scoliosis surgery or anything like that. So we're really blessed that this work has kept her so healthy and kept her body so well.
That's incredible. And so what was different about the John Barnes approach that made you dive into that one?
So really with my daughter, we have explored over the years I want to say almost every therapy that exists, which is kind of crazy. I always tell I work with a lot of special needs kids and their parents. And I always say, if you're thinking about doing something, ask me about it, because we've done it. And, I can give you some feedback on what things will help the most. So why I felt like the John Barnes method was different is really the time element, that the therapists spend the time to wait for the restriction to release in a three-dimensional way that is so profoundly helpful to the body. So most other therapists don't have the time. Typical PT is done in 15-minute increments, and you may only get 15 minutes of hands-on with your PT. Even the pediatrics, that are treated for an hour, a lot of times, the therapist will not hold a release for 10, 20 minutes. It's just not the way people do it typically. So, but with the Barnes method, we're trained to feel into the body and to hold at what we call the barrier, where we feel the body pushing back, and we wait there, sometimes 20 minutes or more. Like when we're working on the psoas, which is one of the largest muscles in the body, the PTs call it hip flexors. Sometimes we'll hold that muscle for a release for 20 minutes because it's so huge and it's so strong. Like it takes that long for it to start letting go. So stretching fascia or releasing fascia, really, because we're not stretching it, is like stretching saltwater taffy or stretching steel. So there's the physics of it is you have to take it to the barrier where it wants to pull back and hold it there until it lets go. And that's really the difference.
Okay. And then why don't you go into what is myofascial? Let's kind of back up a little bit and talk about just a little bit of anatomy science. So people not in our anatomy physiology world can relate.
Totally. So, so fascia is all over our body, through our body. It's the three-dimensional web that holds us together. So if you're in a bad car accident, your body doesn't splat into a million pieces. It's the myofascia that holds it together. And it's, consists of your muscles, your cells, your skin, everything connected together in a three-dimensional web. And it has layers to it. And really what's between all the layers is water, or what has recently been identified as structured water. It's like a new phase of water, the fourth phase of water, which is identified as like H3O. And it forms this collagenous kind of gel and allows the layers to slide back and forth throughout your body. That's what gives you the ease of movement. So that's what myofascia is. It is all over your body. I saw this one representation once, this drawing that I thought was really illustrative of our thinking. It's like you may go to anatomy class and learn, well, there are 600 muscles. And we say, well, are there really 600 muscles, or is there one muscle with 600 fascial pockets? So if you look at the whole body of everything being connected, and as myofascial therapists, we know this to be true because we can be working on one part of the body, and people will say this to us all the time. Is it weird that I'm, feeling that in my shoulder, or, I'm working in the pelvis, and they're like, why am I feeling that in my foot? It's always a mystery to people, but not to us, because everything is connected.
Right. And that's also one of the beauties of everything being connected, but also a challenge, because if you have an area that you're having pain, a lot of times with traditional PT, you look at the joint above and below, but your approach and what I do now, which is not physical therapy, it's the holistic approach.
Of course.
There's a beauty to it, as well as you and I both know that our emotions and what we're experiencing get stored in our body. So if we took a very narrow focus at looking at someone's particular pain, we may miss out on all the other contributing factors to that.
Sure, even traditionally, how you're given a script to treat a shoulder.
Yes.
Well, you're kind of limited, and you actually are, legally limited to just treat the shoulder, but the shoulder probably won't ever get better if the psoas is too tight, because that's pulling up into the torso and into the shoulder. So that's why, you have to look at the body holistically. It just doesn't work to just look at it in little, compartments. So.
Right. And so when someone comes in with an issue, can you walk us through what that looks like from a myofascial treatment point of view?
Right. I often see everyone comes in and they want to know, do you treat this? Do you treat that? Can you help with this? Can you help with that? And basically, yes, we can help with everything. The only thing we can't do is regrow bone. So if you are cartilage, so if you have, degeneration of your hip or your knees or your spine, we can't regrow bone or cartilage, but we can buy you time by creating less compression and creating more space in the back and the hips and the knees. So basically we treat everything. So when people come in, I'll say the most common thing that people come in with is lower back pain or sciatic pain, because everyone sits at a desk and they're not moving enough. And you've heard people say, sitting is the new smoking. And that's kind of, what we see, because people show up with back pain. That's the most typical thing that we see. And when people come in, we do a postural analysis. So, honestly, to be fair, we're even looking at them when they walk into our office or they're sitting in our waiting room. If they're sitting forward and you're leaning on their knees, well, we know their psoas is too tight, or their hip flexors, because they're shortening them. If they're sitting back in the chair and they're all this way, we know their back is too tight, because that's a comfortable position. If their right leg is crossed over their left, we know their right psoas is tighter, because that's a comfortable position. So we actually know a whole lot before our clients even walk into the room. But we do an official postural analysis where we look at, the height of their hips or their hips level. Is one leg turned out or turned in? Is one shoulder higher than the other? That sort of, just sort of symmetrical types of analysis. And then we have an intake form with lots of questions and just about surgeries and, trauma and stress levels and different things like that. And then we have them lay on the table on their back, and we further assess for symmetries or asymmetry, because it could be very different lying on the table than in standing. And then we start to work, palpating different parts of the body, seeing what's tight. We generally start to work in the pelvis, because it is the foundation of the body and affects above and below. So very often we'll start working in the pelvis, even for somebody with neck pain. A lot of times they'll say, are you going to work on my neck? I'll be like, yeah, I'm going to get there. But, I'm not going to. If you look at, sort of the dynamics of the body, you have all these small muscles attached in your neck, but you have this huge psoas muscle, which I'll show you on my little thing here. This is the psoas muscle. I don't know why I'm becoming fuzzy. Yeah, but this is the psoas muscle. It's enormous. It attaches to 5 vertebrae in the lumbar spine, and it really can pull your car. It can pull 2,000 pounds of weight. So if that is super tight, there's really no way I'm going to get these tiny muscles in your neck or upper body to move if you have this huge force in the lower body pulling everything down or forward. And I just explain that to people. It makes logical sense once they understand that. And then we also show clients how to self-treat so that they can keep the progress moving forward when they leave. And then we also, we just work through the body. The beautiful thing about myofascial release is that your body will always show me where I need to work. So we say it's like peeling an onion. We're taking the layers apart, and your body will always show me 100% of the time where I need to work next. It's not always obvious on the very first session, but it always over time shows up. which is really the beauty of the therapy.
Absolutely. And a lot of times we don't realize this, but we put ourselves in a pattern where the nervous system causes those muscles to contract and become restricted because we're taught a certain type of posture is the best, but it actually increases abnormal use of those hip flexors or psoas. So it's a matter of this fine balance of, okay, get hands-on to help something release in the fascia. And then there's some behavioral training that typically needs to happen as well, so you don't keep repeating or falling back into that same pattern.
Yes, and we talk a lot about too, like you're such an expert into the breathing and breathing techniques to change your nervous system, to try to shift those deep holding patterns. And so sometimes people will experience while they're being treated, their body will start to vibrate or shake, which we call myofascial unwinding. And it's just really the body letting go of a deep holding pattern. They can be emotionally based. It can be from a physical trauma, often like a bad car accident or a bad fall. And it's the body letting go of that deep bracing or holding pattern, and the energy of that trauma is leaving the body. And it's a very healing, transformative thing. It just feels a little bizarre to people sometimes.
Do you typically warn people that something like that might happen? Or do you let them experience it? And
I typically don't, because a lot of times then people, have this thing like, why am I not unwinding? Like, why, they have a pressure of like, they want to get better, they want to let go. So I don't want to put any additional pressure, just sort of create a space where that can happen.
Yeah, no, that's
you can't force it. So.
Right, exactly. And sometimes if people are expecting something, then they get disappointed, which causes them to guard, and then you go through that spiral.
Yeah. But it is, I will say that most people don't do that typically in a first session because everything's new and they don't know what to expect. But occasionally people do. And they're kind of like, why is my body shaking, or why is it moving? And I was like, it's really a wonderful thing. It's just your body shifting, letting go, releasing. And it's really the transformative part of the work, because people feel like a new person when that happens.
Right. Now, with certain conditions out there, fibromyalgia, some chronic pain syndrome, CRPS, typically a person is too sensitive in their skin to be touched. Do you still work with people in this scenario, or how do you address that?
Sure. So the other term, as you know, for fibromyalgia is myofascial pain syndrome. So myofascial release really is the answer for it. But you're correct. Some people are so sensitive. And I try to explain, people with fibromyalgia are really super sensitive energetically. So they move through the world in a very sensitive way, and they really have to learn how to manage their energy and really control the energetic space around them. And we help them, do that by just turning down the stimuli and focusing on breathing and meditation. And it's really, like I explained to them, and it makes so much sense to people who are like this, is that, for most people, if I just yelled at you and said, oh, you're a terrible person, how could you do that, whatever, you're like, you just let it roll off your back, whatever. But for people who are very sensitive energetically, it's like a knife going into their body. It's a wound that they walk around with. So we try to help them protect their space energetically. But if a touch on the skin is even too much, we can work off the body in their energetic body until they're at a point where they can, tolerate touch.
Now, is that, when you're talking about energetics, and is that more of the bioenergetic field, or is this part of the myofascial training that you've had?
It is part of the myofascial training. Okay. There's definitely an energetic component. Absolutely. Okay. Yeah. Okay. But I find honestly that most people with a fibromyalgia diagnosis still can tolerate touch. It just has to be, you just have to ask permission to enter their energetic field, and it has to just feel safe to them, honestly.
Yeah.
because they are so guarded.
Right. And there's takes time to build that trust. That's the other part of it.
Absolutely.
Really
Absolutely. I
does.
mean, I've been so blessed to work with people who have undergone really significant traumas, both physical and emotional, and to be able to create a space to allow them to let go and heal is probably one of the greatest gifts in my life. So very grateful for that opportunity. No, you're frozen, Amy.
There you are. Are you there now?
Yeah. Yeah.
Okay. Can you say one more time you've been blessed to work with, and then that was the end of what we heard?
Okay, so I've been blessed to work with clients who have undergone really significant physical and emotional traumas, and the ability to create a safe place for them to let go and heal has really been one of the greatest gifts in my life. I'm so grateful for it. Yeah.
Yeah. And when you have those interactions with people and they trust you to share that aspect of their life, it's a beautiful relationship. It's, I guard those situations with my life because someone is, being that vulnerable. And I can imagine just with some of what you said, you really help people find a release.
Yes, and I feel like it may be, my treatment room may be the only place that they feel safe enough to do that. So that's what I always want to create. Sorry, you froze again.
Yeah, there you go. Go ahead.
Okay. So I was just saying that, it's such an honor, and that's the environment that I always want to create so that people feel that they can, what I say, leave it in the room. They don't have to carry it around anymore. They can leave it in my room. Yeah.
That's amazing. So can you give us like just some examples, maybe some different types of examples of people who have benefited from it? So obviously there's all walks of life, but just if you could give us some ideas.
Yeah, it's really, I say it's such a incredible honor to work with infants. I've been in the delivery room with a few friends or family members where I've been able to treat the baby right after birth, which is remarkable because birth is traumatic, and it's so helpful to create, an environment for a settled, calm, happy baby to be able to take the birth trauma out as soon as possible, which is really great. So that's like the earliest. And I've also been with people on their deathbeds. So when they're transitioning, and there's some, energetic things that we can do to just help people be calm and lose the anxiety and just have a more peaceful transition. So that's the breadth of it. And then, everybody in between, a lot of kids with special needs can really benefit from myofascial release, teenagers with anxiety and, physical manifestations of just the stress of being a teenager in today's day and age. Athletes, we work with a lot of, teenage, high school, college athletes, people who are trying to, just get a little bit extra performance so they can get that scholarship to college and that sort of thing. People who are trying out for the Olympics. We've even had a few Olympic athletes. It really does allow you that extra performance. If you can release your connective tissue and you're a swimmer and you just need to reach the wall a half an inch sooner, it can give you that edge. So that, those sorts of things. And just a lot of, I would say, middle-aged people with chronic issues, lower back issues, frozen shoulder, plantar fasciitis, a lot of TMJ. We get referrals from dentists in the area to work on oral issues, a lot of concussions. We get referrals from the concussion center in our area. And it's really important, I want to say, for concussions to get the myofascial treatment, and really the cranial sacral work, where the cranial sacral system, if people are not aware, is the fluid that surrounds your brain and spinal cord. And it has a motion, it has a wave about 6 times a minute down toward your tailbone and then up toward your brain. And when you have a concussion, that motion is really disturbed. And I can actually hold onto someone's head and feel how bad the concussion was and where it was. So it's really important to try to balance that fluid. I tell people it's very similar to shaking a bottle of seltzer. So you have a lot of energy that goes into that closed system, and you need to rebalance it. You need to let it out, or it's just going to, prohibit the kids from returning to the sport, returning to school. Especially, they're more likely to have another concussion, and that's what we see a lot. I typically see the kids who aren't getting better, who've had multiple concussions.
Okay.
So I just really want to put that out there because it's so important, to have someone treated. Even one session can dramatically change their recovery. Yeah, and just, a lot of chronic migraines, those types of things. I just want to, like, all the things that affect fascia, or like hydration. That's one of the most important things. How much water you're drinking, is your tissue hydrated? Your nutrition, are you eating inflammatory foods? Are you eating healthy foods, right? And one of the minerals that's so important for the health of your fascia is magnesium. And so if you don't have enough magnesium, your connective tissue cannot relax and release. So you need calcium for your muscles to contract, but if you don't have enough magnesium, you're going to stay in a chronically hypertoned state. So we recommend most people will supplement magnesium unless they have a kidney or liver issue. Stress, as you know, is probably the number one factor creating tightness in the body. And then just injury. Is there have been a physical injury, say from a fall or car accident, or emotional, injury, trauma.
Right. So it really does cover the gamut. Now, someone who has an acute injury like a broken bone, or let's say they're undergoing cancer treatments, those types of scenarios, do you hold off on a certain time period? Do you dive right in? What are some of those scenarios look like?
So we always say, like, we are the second aid. So you need to go get first aid. If you have a broken bone, you need to go get to the hospital and get it set, or you need to get your chemotherapy and that sort of thing. But then we are the second aid, and we're going to support the healing, so we want to take any restrictions out of the body surrounding the broken bone, so it doesn't get pulled apart. It can, grow back together and heal as quickly as possible. And then with regard to people with cancer, we know that the myofascial therapy does help boost the immune system, because as you're opening up the body, you're getting more blood and oxygen flow and lymph flow, and you're just healthier. That was one of the most dramatic things with my daughter. She would always get these little colds and just, be sick often with little things. And since she's been getting myofascial release, she is very rarely sick. We never see the doctor. It's just so remarkable. So we know it helps boost the immune system, and we know it helps, the chemotherapy get into every cell where it needs to go to be effective. So it's a wonderful complement to the cancer treatment or to recovery, from any surgery. We can work on people's scars. You want to treat every scar in the body after surgery, starting about 6 weeks after surgery. You can start treating the scar, because externally you can have this beautiful little scar, but internally it can be this web of, scar tissue. And over time, as the scars get a little shorter and a little thicker, they start pulling on different things in the body. Or, as you know, sometimes like in the abdomen can create adhesions and really create a very dangerous situation if your colon starts twisting or things like that. So you really want to treat every scar in the body. One of the stories that John Barnes tells that I always think is so dramatic is he was treating a woman who had this tiny scar on her finger, and she had chronic migraines, and he was treating her and she wasn't really getting, the migraines weren't going away 100%. And he treated that tiny scar on her finger and her migraines went away. So somehow, it was pulling up through her arm into her neck, into her head, and creating that situation. So you can't really discount any scar, no matter where it is. So
yeah, that's wonderful. And I imagine when someone's going through a treatment with you, you probably check all their scars and check the mobility of their scars as well.
yes, exactly. Go into every scar, and a lot of people have laparoscopic surgeries, and those are particularly interesting because it's like a little tunnel. As the scar starts releasing, you can end up on a total other side of the body. It's really quite remarkable. So yes, yeah, every scar we investigate.
That's wonderful. And so when people undergo a session, is it for an hour or is it longer or shorter?
Typically, it's a little bit less than an hour. In my office, we book on the hour, but some people book an hour and a half or 2 hours. If they're coming from a longer distance, they might book a 2-hour session.
Okay. And
I was going to say, occasionally people will come for an intensive. So recently we treated a wonderful little girl from Ohio who came and she had a congenital issue, a trisomy deletion. And she has cardiac issues, but also very severe scoliosis. And so her orthopedist is saying, absolutely, she needs a scoliosis surgery. She's 10. And her cardiologist said she will never survive it. So her parents brought her to us for an intensive, hoping to prove the concept that that myofascial release would help her. And we did 10 sessions over 5 days, and her curve improved dramatically.
That's wonderful. Oh my, that's really neat to hear. So now that was a very different scenario where people are going back, where she was going back to back. What do people who aren't doing an intensive do? Is it once a week?
So typically when we see people, when they come, especially if they have an acute pain situation, I mean, we might see them 2 or 3 times in 1 week if they're really in a lot of pain. But typically, also because we're really busy, we'll see them once a week and just also give them, teach them some self-treatment. They can keep treating at home. And we'll see them once a week until they're feeling better. And that's the typical pattern. People keep spreading out their visits until they're really good at self-treating at home, and they know when they need a tune-up, they'll come in for a little tune-up. But yeah, we like to empower them and teach them, and we've had clients who, are teaching their family members or, run into strangers at, country clubs or whatever, and they're teaching them how to do myofascial release, which is, really gratifying. So spreading the word.
Absolutely. Well, this is great. And obviously you're in New Jersey. So if people want to reach out to you, or if they want to come and fly and see you, what's the best way they can get a hold of you?
So the best way is through our website. You can just go to myofascialfreedom.com. So that's MYOFASCIAL freedom.com. And you can put an inquiry in through the website. And there's also a directory that I should mention of John Barnes trained therapists. It's myofascialrelease.com. There's also great resource of articles and all sorts of information on myofascial release, but you can find a therapist who is trained in the Barnes method in your area through that website.
Okay, that's wonderful.
Yeah, and I'm really happy to respond to any questions you people may have just about their situation or how myofascial release can help them.
Yeah, you've been very responsive to me and I appreciated it. So I know you'll do the same for others. And I really encourage people to take advantage of that and reach out to you. So thank you.
Great.
Yeah. So any last minute tip that you want to share that we didn't cover?
I guess I just want to talk about if there's one self-treatment thing that I could teach people that would be super helpful, is just to use this type of ball. You can also get it on Amazon. It's like a 4-inch therapy ball, or you can use a tennis ball or any other ball your kid has, your dog has, or whatever. And what you want to do is you want to place it between, I'll show you, between your navel and your hip bone is where the biggest part of that psoas muscle lies, and you're going to lay down on it.
Okay.
So you're just going to lay on your bed or on the floor, and you're going to lay there for about 5 minutes. At least you don't have to move or roll around or anything. Just lay on it, because it's pressing on your psoas, and it will relieve or release the pull on your lumbar spine. So for people who sit a lot and have chronic back tightness or back pain, that's the biggest thing. And sometimes you might have to lay on it for 10 minutes. But I know during COVID, when I was very stressed out, I think there was one day I laid on the ball for 20 minutes on each side to release. That's how stressed out I was. So, but that is the most helpful thing that you can do. And then you can use the ball against the wall on any other part of your body that feels tender, but applying the same principle of just pressing into the discomfort and waiting for it to soften where it doesn't feel as tender, and around your hips, lower back, anywhere. So that's kind of a really broad stroke of how you can use the myofascial release at home.
That's wonderful. That's a great tip. Thank you for sharing that. Appreciate it.
And you really don't even need to have a ball. You can use an apple or an orange.
Go through your pantry and find something round that's won't hurt you too badly. So I like that. Very nice. Perfect for coming fall season when the huge Honeycrisp apples are ripe. You can use one of those. So
yes, or all those little decorative pumpkin things, gourds and whatever. They would be great too.
Absolutely. Well, thank you again so much for joining us today, Sue Ellen. Really appreciate it. And people take advantage of reaching out to her.
I'm really happy to help. So
wonderful.
There's no question that's, too bizarre or.
Wonderful. So thank you all for joining in today and sharing this time with us. We will see you again next weekend. Have a great rest of this weekend. Bye now.